Hello, my name's Dr. Kerry Kalis. In this session we're going to talk to you about eyelid rejuvenation surgery, otherwise known as blepharoplasty. Upper eyelid surgery is performed for heavy excess skin on the upper lids. This can obscure vision. It makes us look and feel tired. It can often lead to irritation of the lid skin. It's a relatively quick and safe surgery to perform. On the lower lid, it is usually performed for puffiness and bags. Occasionally, it is performed to improve the droop of the lower lid. These appearances can make us look tired. It is often associated with dark shadows or rings under the eyes. It may be performed with an internal incision behind the lashes or a lower lid external incision under the eyelashes. Eyelid surgery is usually done under a very minor twilight anaesthetic. It takes about 30 to 60 minutes. It may be done in association with a facelift. They are very commonly performed operations. This slide shows the typical incisions for an eyelid rejuvenation procedure. On the upper lid, the incision is well and truly concealed in the crease. On the lower lid, as previously discussed, it may be external or internal, but once again the scars are very good once fully healed. On the day of your surgery, if you prefer hospital, one should fast for 6 hours and admit 2 hours prior to the procedure. You may choose to have a general anaesthetic or a twilight anaesthetic. You may go home the same day or the following, depending on your requirements for pain control or the need to rest. Ice and head elevation are important to control bruising and swelling. Most patients have their surgery performed in the office as an outpatient procedure. One day after the operation, there is usually only minimal swelling and bruising. There is negligible pain. Occasional difficulty is had with lid closure, and the lower lid may appear temporarily saggy. Ice at this stage is optional, but may be added for comfort. 4 to 7 days after your surgery, the patient should return to the office for suture removal. Most bruising will have improved or gone. Vision is usually normal, or if not, it will be dramatically improving on a day-by-day basis. Scars may be visible for a further 6 to 8 weeks as a visible, very faint red line. Sometimes it is necessary to use some concealer if one is making a public appearance. After your first post-op visit, arrangements will be made for a second visit at 6 weeks. Let's have a look at some examples. This patient has excess skin on her top lids. In the middle picture, she is approximately 3 days post-op. In the right-hand picture, she is 5 days post-op and a lot of the swelling and bruising has gone. Her stitches have been removed and the excess skin has also been removed. Here is the same patient at an oblique angle. She is using a little concealer to cover the scars. In this case, there is heaviness of the brow and excess eyelid skin. The brow has been lifted and the excess skin has been removed with the blepharoplasty procedure. So this case does also involve a simultaneous brow lift. In this case, there is obvious excess skin on the top lids, and in the right-hand slide, you can see that the skin has been removed. Simultaneous lower lid laser resurfacing was performed. In this case, it's obvious to see the excess skin on the top eyelids. The right-hand slides show a lovely rejuvenation outcome with a nicer, well-defined upper lid groove. This case is a little more subtle, but the skin on the upper eyelid has been rejuvenated by partial resection, and there has also been a simultaneous laser resurfacing of the skin on the lower lids. This is very handy for improving crepey skin in this area. This patient has had top and bottom lids rejuvenated with blepharoplasty surgery. This patient has also had top and bottom lids rejuvenated with a simultaneous brow, face and neck lift. The before pictures are on the left and the post-op pictures are on the right. This case shows significant improvement in the upper lid skin excess. The post-op appearance on the right is early and the scar is still a little visible on the outer aspect of the eyelid. The same can be seen in the oblique photo of this patient. This case again shows nice rejuvenation of the upper eyelid. In the post-op picture on the right, she's elevating her brow voluntarily. This was not a surgical procedure, but it does show a nice outcome of the upper lid surgical procedure. This is the same patient taken in the oblique view. Once again, the upper eyelids in this patient have been rejuvenated by skin removal, i.e. blepharoplasty surgery. Same patient in the oblique view. What are the risks and complications? Wound infection, numbness, scarring, recurrence of the original condition, asymmetry, upper lid lag, lower lid droop, visual disturbance and subjective dissatisfaction. Just a reminder, the risks of eyelid rejuvenation surgery are extremely low. Any operation that has an anaesthetic will have slight additional risks or hazards. The anaesthetic for blepharoplasty surgery is a very light anaesthetic. Drug reactions, allergies, nausea, respiratory problems are fortunately very rare. Thank you for taking the time to listen to this presentation. Please don't hesitate to contact either myself or my staff should you require further assistance.